Good evening.
Hi.
I am Michael Gary Scott. Nice to see you here.
Pleasure to meet you, Mike.
Okay. So welcome to our hospital here. We're here at Dunder Mifflin. Are really excited to have this interview with you.
Pleasure to be here.
I just have here. Let's start off with this question. Why are you interested in working here at Dunder Mifflin?
Well, I've been interested in your hospital and your work with children with autism for a long time. I personally have a lot of experience in my practices, in my training with children with autism and different disabilities, and I find it really intriguing, and I hear you're one of the highest recommended, and so I would really appreciate I appreciate just the opportunity to interview with you.
Oh, we're excited to have this interview with you. Do you see yourself as fitting in with the Dunder Mifflin family here?
I do. Walking in, it felt like home. It felt like the personalities just meshed really well. Everyone greeted with a smile, and that's how I intend to be wherever I end up. And so I see that it would be a really good opportunity.
May I ask what philosophy you are in music therapy?
I come from more of a cognitive behavioral idea. But I'm open to anything. My training is mainly in cognitive behavioral training. But honestly, I would be willing to learn about anything at this point.
Okay. That's good to know because we have different philosophies here. I have a quick question. Why is there a gap in your work history right here on the resume that I have in front of me?
Of course. Yes, sir. In that period of time, I had recently gotten married. I was in a car accident, and so there was no ability for me to work during that time. And since then, I have resumed working, and I plan to stay at whatever job I'm at for quite a while.
Right. Is there any difficulties that arose from that car accident that you may need compensation for, as in parking spaces?
No, sir. Immediately following the accident there was, but since then I've had medical treatment, and I should be fine from here on out.
That's good to know. I'm glad to hear that.
Thank you.
Okay. How would your friends describe you?
My friends would describe me as loyal, upbeat for the most part, and definitely there for anyone who needs me.
That's good to know. So would you say that you have a therapeutic personality?
Very much so. Very much so. I'm here to help people.
Okay. That's good to know. Okay. Do you have, if you don't mind me asking, do you have any younger siblings or cousins?
Yes,
All
I have
right.
one younger brother.
Okay, and that helps with this question. Explain how how round robin technique works to your younger brother.
I'm not sure of the technique you're describing.
Oh, all right. Here, we'll change it. We'll just scratch that question. All right. What benefits do you see working here?
I see a lot of opportunity to learn from different personnel and different therapists. I see the opportunity to co-treat with therapists. I see the opportunity to learn from some of your best medical staff. And I see a lot of future here.
All right. Oh, as you may have seen, we are reaching out with our music therapists here to the nearby school districts, and we're working on trying to establish an inclusion setting in those schools. How would you try to sell yourself to the reluctant school district?
Of course. I would begin by giving them a little history of what music therapy is, how it's treating non-musical goals with music. So it's not quite the same as music education, nor is it the same as any other therapy that's out there. In my opinion, I would be more than willing to show them the benefits of music therapy, how it's cost effective, how a lot of times children with special needs don't get the social inclusion they need, and it can cause more behavioral issues than it can avoid them. So in the long run, you would have to talk numbers with a school district. You would have to say, look, your budget is this. I understand that that's a lot of money for you. However, look at all the possibilities we have here that could save you money in the long run, because a lot of times school districts, while they're looking out for the kids, they're also looking out for the budgeting, and you have to appeal to that side of them.
Alright, say that still didn't convince them, but you have a friend in the music education department in that school. How would you work with them to try to, like, still establish yourself?
Of course, of course. So, luckily, I think a lot of music educators are very open to the idea of music therapy. So I would work with them, and if the school district wasn't willing to do co-treatment, you could definitely work with the staffing to do trainings for them and teach them just different ways that music therapy can be used in segments in their classrooms, and definitely open up doors for the staff to believe in it. That way they could then work with the school district to open ideas.
Okay, very well put. What population do you most want to work with? I understand that you're looking here at the Children's Hospital, but of course that may not be where you want to.
Of course. For a while, I didn't know, and honestly, I still am not sure. I'm very open to any population. For sure, children, that's something I definitely feel my heart toward, but I am not opposed to adults. I'm not opposed to geriatrics. I am very open to any setting for the most part.
That's very good to know, because we're also opening up a geriatrics department in this hospital, and we are currently, it's for a long run, so we're looking for in the future a music therapist to start in that section.
It's good to know.
Would you please perform a song in its entirety you'd use this with this population that you've decided?
Yes. Daddy's taking us to the zoo tomorrow, zoo tomorrow, zoo tomorrow. Daddy's taking us to the zoo tomorrow, where we can stay all day. We're going to the zoo, zoo. How about you? You can come too. We're going to the zoo, zoo. See the elephants with the long trunks swaying, big old ears and their long trunks swaying. See the elephants with the long trunks swaying, and we can't stay all day. We're going to the zoo, zoo. How about you? You can come too. We're going to the zoo, zoo. Daddy took us to the zoo today, zoo today, zoo today. Daddy took us to the zoo today, and we have stayed all day.
Very nice. That's a very cute song. How would you adapt this if your objective was memorization with your client?
Yes, I've found that a lot of visual aids work well. So if we're talking about memorizing with a young child, of course, you could bring in different animals for them. You could have different visual aids for them, and slowly fade out the song to where we could talk about just the animals themselves and the lyrics, and eventually the music wouldn't be there, and they could tell the story of going to the zoo without having any sort of aids at all.
All right. How would you include the family if they were there?
Of course, you can add in brothers and sisters. So brothers saw the monkeys and they were scratching, and sisters saw the fish and they were swimming. And so we could definitely incorporate the family and ask them different ideas of what they would like to sing.
All right. So, do you have any questions or concerns?
I do have a few questions. My question for you would be, what is your hospital's therapeutic philosophy?
Well, the one that you'll be working with at the Children's is, luckily for you, a cognitive behavior philosophy. But we have a few on staff who are of different opinions, and you will be working with them. You'll have about 2 supervisors. One is behavior cognitive, and one of them, she'll tell you herself what she is.
All right. I also have another one. What opportunities would you see for a potential intern here?
Opportunities? Well, we have a couple case studies that you'll be helping some of the music therapists, your supervisors, on. And if you're concerned about like work opportunities, we do have, outside of your internship, you have opportunities to we have an orchestra here that plays about every Sunday for the patients who can't go to church.
Okay.
And you do get paid for that.
Okay.
Because some of them are doctors and some of them are outside hires. And also, on the weekends, we have some other just job opportunities nearby that you can apply for if that is a concern of yours.
Okay. And then, knowing that there might be some commuting involved to schools and that, is there any sort of fuel stipend or anything to cover those expenses?
There is not a fuel stipend, but if you work if we hire you, you will get free parking in the garage, so you won't have to worry about finding a spot.
Okay.
And there are opportunities. We have some cheaper apartments that are located close to the campus. That way you don't have to worry about driving as much. If you don't have a car, it's within safe walking distance. And if you do have a car, again, you have the garage.
Okay, great. And I don't have as much experience with groups, and I would like to expand that. I have a lot of individual experience, which I think is great for the hospital setting. But what opportunities would you have that would allow me to get more group experience?
Here we actually do a lot of group work due to patients being inconsistent. That way the interns have experience with patients because you never know what's going on with the child. Like, we could just bring them in for a normal surgery and then we're having to postpone it, or they will get sick and we can't have anyone going in because if you're sick, their immune systems are compromised. So we have a lot of apologies. We have a lot of group work for you to work with. That way you have at least a consistent group number and you'll see patients every day.
All right. I think those are all my questions.
It's very nice working with you.
It's great to meet you.
We'll see you in about not see you, but we'll send you an email in about 2 months.
Great, thank you.
Thank you.